Hello, Mike Jones, Fire Chief and Emergency Manager for the City of Fredericksburg. Again, to bring you the weekly COVID-19 update for the City of Fredericksburg. Let's start off and talk a little bit about signs and symptoms of COVID-19. There's been a lot of questions going on recently with kids going back to school and starting to bring home some illnesses and things like that as kids spend time together in school. You know, what are the signs and symptoms of COVID-19 versus the regular flu versus RSV, which is a respiratory illness that can affect children and things like that. Well, there are some, with the Delta variant out there are some changes in the signs and symptoms related to COVID-19 compared when we first started the pandemic. So they produced a document out there that talks about the signs and symptoms of COVID-19 versus what would happen if a child had RSV or a child or an individual had the flu. They're probably too numerous to mention here, but we do have a document we're going to post on our website by tomorrow that will explain those signs and symptoms for each one of those diseases. So you can check that out at www.fredericksburgva.gov. Let's talk a little bit about vaccines. We're starting to do better in the area. We've now, in the city of Fredericksburg, have a little bit over 60% of our adults aged 18 and above that have now had at least one dose of the COVID-19 vaccine. That's just a little bit under 15,000 people, so that's good to see. We want to keep getting those numbers up. So if you have any doubt about it or you're interested in it, please go out and see your local pharmacist or other locations. You can look at the health department to find a full cadre of locations that have the COVID-19 vaccine so that you can get that. If you need testing, again, we have testing available every Thursday. It's a drive-up clinic. It's at the Bragg Hill Family Life Center. That's 400 Bragg Hill Drive up on top of Fall Hill Avenue just before you get to Interstate 95. And that is a drive-through clinic. It's held on Thursdays. Pre-registration is usually best, but you can just show up. The number of people getting tested has increased drastically in the last several weeks, so you want to make sure that you get a spot to get your testing done if you feel that you need to get tested or you've been exposed to someone that's had COVID-19 or you think that you may have COVID-19. So that's important as well. So I think all those things are good. As far as the prevalence in the community, we're still above 12%, almost at 13% with the percent positivity over a 7-day rolling average. The last statistics I saw the end of last week were at 12.8% positivity. The number of people in the hospital is just under 100. So that would be all three hospitals in the health district: Mary Washington Healthcare, Stafford Hospital Center, Spotsylvania Regional Medical Center. So it's very important that we try to get the number of people out of the hospital and those people that are sick with it. The best way we can do that is vaccinations. If you're not going to get the vaccine, or if you want to have a little bit better handle on how you protect yourself from COVID-19, again, the standard infection control practices are really great. Stay 6 feet away from people if at all possible. You can have conversations a little bit farther distance apart, and then washing your hands frequently during the day, and especially after you've touched high impact surfaces, is always a great way to go to try to do that. We'll provide additional statistics and more information again next week. Thanks.